Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. This evening, we're going to look at those things you might be doing which might actually be contributing to your inability to become pregnant. Now, I know so many people want to become pregnant in 2022. In our group, we don't just want you to become pregnant, we want you to become pregnant the right way. Then we want you to also make sure that your pregnancy is uneventful. In medical practice, when something is eventful, it means it doesn't have a good outcome. So we want you to become pregnant. We want you to have a smooth pregnancy experience and also have your baby. Now, there are a couple of things you might be doing without knowing that it's actually part of the reason why you are not becoming pregnant as and when due. So the topic for this afternoon's discussion is 5 major reasons why you may not be able to get pregnant. 5 major reasons why you are actually not getting pregnant. So I'm going to use it interchangeably. So we're going to look at these 5 things which you might not even know it might be contributing to your inability to become pregnant. Pregnancy is a well-defined process. So if you don't observe the right steps, you might actually be the person delaying yourself from becoming a mother, from becoming a father. And this has to do with the two partners. So I will encourage the men to also play a role in the process of starting the family. In as much as the women are the carrier, so the woman is going to be the person that will carry the baby, I encourage the men to remember you have to play a role in starting your family. Starting your family actually starts from the moment you meet your partner. It's not a one-time thing you wait for a particular time. It's something you have to have a holistic approach. So without wasting much time, we're going to look at the 5 factors which might be playing a role in your inability to start your family. So I will encourage you to, make sure that you're following attentively because these are the things that will help you to shape your journey.
Dear Tampa.
Hold on. Sorry, guys. These are the things that will help you to shape your journey towards starting your own family. Very important. Very, very important. So please, if you come in, my name is Dr. Chudi Ufondu. I'm the convener. If today is the first time attending the clinic, please remember to subscribe. Remember to like, remember to comment, and you also have an opportunity to get feedbacks to your questions. So what's the first thing that might actually be the reason why you haven't had your babies? You are not having enough sex. You are not making love enough. You are not trying enough. Now, I know so many people will swear by Amadioha that they make love like anything, but you're not making love enough. The gold standard in our organization is 48 hours lovemaking. So I'm going to be very simple about that. Today is Monday. If you are not bleeding, it's expected that you would have met your partner today being Monday. Now today is Tuesday. Sorry, I'm confusing you guys. Today is Tuesday. So assuming you made love today, you're dry. Tomorrow, you can have a break, but if you still want to make love tomorrow, still make love. There is no timetable. The more you make love, the more you're actually increasing your chance. So lack of adequate love making, it's number one reason why so many people are not pregnant. It will surprise you, and it cuts across all age strata. But importantly, if you are above 35, you have to make love regularly. It doesn't matter what your diagnosis is. It doesn't matter your age. It doesn't even matter if you're getting ready for IVF, IUI, surrogacy, adoption. It doesn't matter. You can spontaneously become pregnant simply by making love. So number one thing which you might be doing right now, which it's possible you're actually the biggest culprit. If you are not making love enough, if you didn't make love enough in 2021 and previous years, in 2022, making love your top priority. If you want to be a mother in 2022, you have to make love around the corner every other day 48 hourly. Very, very, very important. Okay. So that's number one factor, which might actually be delaying you from starting your family. Number two factor, everybody is guilty as charged. Now, if you want to start your family, I want you to take a critical look at your health, at your body weight. Lack of healthy body weight is actually a very big factor, which might be stopping you from becoming pregnant. Now, you can be overweight, you can be obese, or you can be underweight. So you have to make sure you're in the middle. There are so many women that are in the obesity range. There are so many women that are in overweight range. Then there are fewer women that are in the underweight range. We don't want you to be overweight. We don't want you to have obesity. And definitely we don't want you to be underweight. So keep your eyes on your BMI. The way to know if you're outside the range is to use your BMI. BMI stands for body mass index. So if as a woman, your BMI is below 18.5, that's a problem. We want your BMI to be above 18.5. Now, if your BMI is above 30, you have obesity. We don't want it to be in 30 at all. If your BMI is above 25.5, that's overweight. So work towards coming to 18.5 to 25.5. That's the normal range. Now, how do you calculate your BMI, your height, and your weight? You plug in the number and it will tell you the truth. It's not a perfect measure of your body weight, but it will help you to have a healthy body weight. When you are obese, or when you have overweight, or when you have underweight, you are not going to ovulate as you should. And when you don't ovulate, you cannot become a mother. So overweight, obesity might affect your ovulation, just like underweight can also affect your ovulation. And if your ovulation is not confirmed, you cannot be able to become pregnant. So these are the things you can do by yourself. So you can easily make love. You don't need to go and buy lovemaking from the market. Definitely, you can work on your body weight by modifying your lifestyle. So work on getting your healthy body weight. The more healthier you are, the more you have a chance of increasing your possibility of becoming pregnant in 2022. Now, the next factor, some women go overboard when it comes to exercise. Exercise is very important for every adult. You are encouraged to exercise for 30 minutes every day. So out of the 24 hours that God gave you every day, bring out 30 minutes. Find a convenient, user-friendly exercise. Please indulge in it. So in as much as we don't want it to be a couch potato. So couch potato means you wake up in the morning from your bed to your car, you're just all over the place. You don't move your body. We don't want it to be that. But please be careful. Don't go overboard. If you are planning to become pregnant, don't go to the gym and live in the gym. Don't just go extreme. Go easy. When you go overboard, it's going to affect your hormones. When your hormones are affected, you will not have that ability to be a woman God created you to be. So please work on the intensity of the exercise you engage in. No rigorous and excessive exercise. Moderate exercise. Dancing, walking, swimming, running, they are all okay. If your weather is inclement, there are a couple of things you can do indoors and you can still exercise. The next factor, poor sleep. So many people are not sleeping. It's possible that the reason why you're not pregnant today is because you have very poor sleep hygiene. If you are not getting enough sleep, if your body is deprived of sleep, your hormones are not going to function properly. Your whole reproductive system will be in danger. Your whole system will be in danger. So sleep is very important. Are you getting enough sleep? If you're not getting enough sleep, work on your sleep hygiene, work on your sleep habits. If you can improve your sleep, if you can have quality sleep, every single day, you are improving the possibility of your reproductive hormones functioning exactly how God planned it to be. So sleep is very important. Now, please, if you're planning to be a mother, and if you have an option not to work night shift, please work the day shift. But if unfortunately or fortunately the only opportunity you have as regards your job is in the night, when you're done with your night shift, recreate a night setup during the day. Make sure you close your eyes, make sure you dim the room and get good sleep. When you deprive yourself of sleep, you are also affecting your fertility. Now, finally, knowledge is power. So many people are in denial about their diagnosis. So many people are not seeking the proper care. There are so many people that have not seen a gynecologist. There are so many people that don't have a fertility specialist. There are so many people that are in denial. Your tubes are blocked, but you refuse to accept that your tubes are blocked. You keep going from one place to the other to open your tubes. Meanwhile, it's confirmed that your tubes are completely blocked. So denial and lack of baseline knowledge about your potentials of becoming pregnant is also a factor. So you have to make out time. Go to a gynecologist. Go to a fertility specialist. We have a working diagnosis. In medical field, once we have a diagnosis, we have solved that problem by 50%. So you can't just come in and say, I don't have a baby. Oh, I'm finding it difficult to have a baby. But you don't know the major reason why you might not have a baby. It can be the man, it can be the woman, it might be both of you. Sometimes we don't know. So knowing what might be causing this, your attitude, your perception, your practices can delay or facilitate you becoming pregnant. So acquire your knowledge. Don't be in denial. Deal with your reality. Find out everything you need to enhance your chance of becoming pregnant. So just to recap, grab your knowledge. Don't be in denial. Make sure you get adequate sleep. Be very mindful of the type of exercise you engage in. Watch your body weight. Unhealthy body weight will likely lead to inability. Now, make sure you make love round the corner every 48 hours. Very important. So that's my presentation very quickly. And I'm going to give us an opportunity to ask questions. So the clinic is open. Feel free to ask your questions regarding this topic. Okay? Very simple, straightforward points. Make love, watch your body weight, sleep, get the right knowledge, see the right kind of doctor, eat properly, drink your water, avoid your smoking, avoid your alcohol, and you'll be a mother in 2022. Now, depending on your presentation, don't be in denial about your treatment method. If your fertility specialist recommended a particular fertility treatment, make sure you understand it properly. Then work yourself towards getting the resources that will help you to go and do the right things for yourself. Okay? Right. Please, if you have any questions, feel free to ask so I can provide you feedbacks. Chiazaka, thank you and welcome. You can ask your questions. If you are attending, if today is the first day, thank you for coming. My name is Dr. Chudi. I'm the convener of this group. Make sure you subscribe. Share this video with anybody that might be in need. And hopefully, by the grace of God, you become a mother and you become a father in 2022. So please go ahead and ask your questions. Do you have any questions? Can you all see me? If you can see me, just give me a thumbs up and ask your questions. I'm done with my presentation. So please start asking your questions. Okay? All right. So when you come in, ask your questions. Jessica, thank you so much. If you have any questions, ask. Joy, ask your questions. So it's time for question and answers. Yeah, thank you so much, babe. Guys, ask your questions. Even if you're not believing God to be a mother, you can ask on behalf of others because this video is going to go to the community. So even if you're not the person planning to be a mother in 2022, you can ask on behalf of the women that are believing God for babies. So please, if you're in attendance, ask your questions so I can provide you feedbacks. Now, if you ever need any help becoming pregnant, anywhere you are, I can help you. Please come to my community, get a subscription, make sure you're hooked up with me. I will consult you, then I will give you the directives. By the grace of God, I will help you to become pregnant. But right now, ask your question. Okay, the first question says, what's the solution for ectopic pregnancy? This is outside the confines of this particular clinic, but I'm going to provide you feedbacks. You had to, and the only solution was to cut off your tubes. Now, if I understand correctly, I'm going to look at it from two different perspectives. If you're talking about preventing ectopic pregnancy and management of ectopic pregnancy, so preventing it from happening and what will happen when you have it, unfortunately, in your own situation, when you have ectopic pregnancy, we are going to go through the process of salpingectomy. So in order to save you and give you a chance of becoming a mother, ectopic pregnancy is an emergency. There are so many women that can die from ectopic pregnancy. If you are in a facility where they don't have emergency provisions, you can die. You can bleed to death. Because in ectopic pregnancy, instead of the pregnancy to be developing in the womb, it will be developing in the tubes. The tubes are not strong enough to support pregnancy. So what will happen? When the baby is growing, the baby will burst this tube and damage this tube, and you will start bleeding. It's a very, very severe complications. So this is why it's important when you become pregnant, you go for your urine test, you go for your blood test, then you go for your ultrasound. Ultrasound will show us that the baby is developing inside. When a baby is not developing inside the womb, any other place the baby is developing is called ectopic pregnancy. So unfortunately, in your own situation, my sister, we have to cut off this tube, depending on the size. If one tube is cut off and the other tube is healthy, you can still become pregnant, you can still have all your babies. But in your own situation, unfortunately, you have the two tubes removed, so it's called double salpingectomy. In that situation, the only option for you is to go for IVF. What you need to become a mother is just one thing: your eggs. Once your eggs are there, you're a mother. So if you have this unfortunate outcome of salpingectomy, so long as your eggs are good, we can collect your eggs, we can collect your partner's sperm, we can get them together, they can be fertilized, and we can transfer them back into your womb through the process of IVF. If for some reasons that your body cannot nurture a pregnant baby and bring the baby forward, we can use your eggs and we can look for another woman to carry your babies through the process of surrogacy. So what a woman needs in order to be a mother is what? The eggs. Once you have your eggs, you're a mother. Now, in regards to things we can do to prevent ectopic pregnancy, ectopic pregnancy happens when the opening of the tube is narrowed down or damaged or has adhesions. So be careful as a woman. Most of the things that will damage your tubes are from lifestyle. So if you have untreated sexually transmitted infections or poorly diagnosed sexually transmitted infections or poorly treated, two of them are actually very, very detrimental: chlamydia and gonorrhea. So if growing up you pick chlamydia and gonorrhea and they were not treated, they love the tubes. They can go to your tubes, they can damage your tubes. In some women, the eggs can come in, the sperm can come in, fertilization will happen, but because the tube has already been damaged, the journey backward to implant will not happen, and the baby will start developing in the tubes. So anything that damages the tube can lead to ectopic pregnancy. Unfortunately, because by the time we are diagnosing the ectopic pregnancy, it's already late. Most women that will have ectopic pregnancy will lose that tube. If it's diagnosed early, we can give you some drugs. An example is methotrexate. But once it's late, in order to save your life, we remove one tube. Thankfully, if this tube is healthy, you can still become pregnant. Unfortunately, if both tubes are removed, then you need to go for IVF. So any woman that the tubes are blocked, when we tell you to go for IVF, we are telling you to go for IVF so you will be careful. There are some women that will be insistent on getting pregnant, then they will have pregnancy complications. It's not just enough to be pregnant. You have to be pregnant and have a viable pregnancy. Unfortunately, some women will be pregnant and their pregnancy will not be viable. Non-viable pregnancy means a pregnancy that will not yield to healthy baby. So some women can have chemical pregnancy, molar pregnancy, ectopic pregnancy, missed abortion, and so many other things, which means you were pregnant, but unfortunately pregnancy didn't go the way we planned it. Okay, so be very careful. All right, so guys, keep asking your questions. I still have a few more minutes, so if you have any questions in regards to this topic, this is your opportunity. Remember, the topic for today are the things you're doing on daily basis that might be stopping you from getting pregnant. And top on the list is what? Lack of adequate lovemaking. That's number one. It's trending. I know you might be pretending you're making love, and my sister, you're not making love enough. So you better go home and make love. Okay? All right. Good evening, Doc. 37-year-old single without a child. You're not in any serious relationship. What's your advice since you're in advanced maternal age? My sister, you just have to make sure you're ready. You see, being ready is not just about what you say. It's also about what you do. It's also about who you hang out with. Okay? So if you're ready, it doesn't matter your age. Good, you're 37. From 35, we classify women as advanced in maternal age. But the key question is, what kind of relationships do you have? What kind of people do you hang around? What's your social capital? Do you have a relationship now? So you can make yourself someone people can relate with. You can make yourself marriageable. You can make yourself be in a place where you'll be valued. But if you allow cultural, societal values and whatever to stop you, you might limit yourself. Some women are not married today. Some women are not in relationships today because of the tall wall they built for themselves. Make sure you're very flexible. Now, don't worry about this. Look, I'm keeping it real. There are so many women in their 40s that are not married, but they are living their best life. There are so many women in their 50s that are not married, but they are living their best life. They have your own game plan. Know what you want. Make yourself available so that people will find you. Okay? But you're 37. You can marry in 2022 at 37. By the time you clock 40, you can complete your family. So even at 37, you have a better chance of having multiple pregnancies. Okay? So the only advice I will give you is to work on yourself. Work on your self-confidence. Work on packaging yourself. Make yourself, desire, just, dig out your confidence. Don't worry about what people are talking about you because people compare a lot. Oh, she's 37. Oh, why didn't you do this? The pressure might even be coming from your mother. Be your own person. Create your own world. That's a fact. Okay, but don't worry about, it's late or it's not late. When you meet your man, you meet your man the right way. There are some partners that might meet each other at 45 and they can still have a good outcome. The key word is who you're hanging out with. Okay? So don't worry about that for now. But make sure you have your own game plan. Okay? Correct. So you're still asking about the ectopic pregnancy. If it's discovered on time, if it's diagnosed on time, unfortunately, it's not diagnosed on time. We can salvage your troops by giving you methotrexate. But unfortunately, in so many people, by the time we are diagnosing the ectopic pregnancy, it's already late. So we have to remove the troops. Okay? All right. Do we have any other question? Yeah, can I thank you and welcome. If you have any other question, please go ahead and ask your question. So I will give you a feedback. I have about 7 more minutes. If we don't have any other further question, we can close the clinic. But if you have any question, this is your opportunity to ask and you'll receive your answers in real time. Remember, we're talking about the things you do that might be stopping you from getting pregnant. And we mentioned not making love enough. We mentioned unhealthy body weight. We mentioned lack of sleep. We mentioned excessive exercise. And we mentioned being in denial and not having baseline knowledge of what your problem is. If any of these things is applicable to you, work on them. If you can eliminate all these things, you are on your way of becoming a mother and a father in 2022. Okay? All right. Are we good? Okay. So remember, before you go, please drop that like and subscribe and share this community. Tell people about us. We're a very loving community and we're here for you. We want to help you become pregnant, not just becoming pregnant. I want to help you become pregnant, and I also want to help you to have your baby. Until you have your baby in your hands, I've not done my job. So I want you to come in. I want you to heed to instructions. I want you to be practicable. I want you to remember our 3 P's. Pray to God, play 48 hourly, then practice. So if you pray to God every day, if you make love with your partner 48 hourly, if you seek the help of a fertility specialist, nothing can stop you from becoming a mother, from becoming a father in 2022. You can go and mark my words. It will happen exactly this way. So Cheer yourself up, pick yourself up, make sure you're doing your best. The problem is some people are not doing their best. Some people are good in complaining. Some people are good in finding faults for every solution. Any solutions you give to them, they will find faults in it. Nobody can save you except you. So no matter the quantum of complaints you're having, if you don't have your own game plan, nobody can save you. And it's not all about money. Though money is important in infertility management, but there are so many other things you can do. Like if you notice, I haven't given you any drugs. You can work on your lovemaking, you can work on your body weight, you can work on your sleep by yourself, you can work on your body of knowledge. You haven't spent any money, you haven't taken any drugs, but these are the things that will help you to become. Okay? How long does IVF take? So this is a very broad spectrum question. The duration of IVF is individualized. Now, IVF is dependent on how you responded. IVF is dependent on your baseline investigation. So if you're a young lady and unfortunately IVF is your option and all your hormones are okay, estrogen okay, FSH okay, LH okay, prolactin okay, progesterone okay, and we challenge your ovaries and you give us enough eggs and your partner has good sperm, your IVF can be done as early as within less than 2 months or less. So it depends on how you respond. Because in the process of IVF, we're going to give you a lot of drugs. We're going to see how the drugs will respond to your ovaries. We're going to see how your ovaries are going to release the eggs. Then we're going to look at your womb. So pretty much in IVF, what we do is to bring the two partners together. We take a look at your partner's sperm. We take a look at the woman's potentials of having eggs. Then we begin to give the woman a lot of drugs. The drugs will go to the ovaries and challenge the ovaries to release all the eggs in that particular cycle. So if you're blessed to still have eggs, when we give you those drugs, we are going to collect all the eggs you have in that cycle. We'll store them. We go to your partner. It's assumed that your partner will have good sperm. We collect your partner's sperm. We collect those eggs we collected, a couple of them. We join them together in the lab, and there will be fertilization. The union of the egg and the sperm will lead to embryo. Once we have that embryo, we check the quality of the embryo. Once we are good, then we transfer it back. Once we transfer the embryo back into the womb, we give you 14 days. After 14 days, you will have your pregnancy test. You will become pregnant. You go for your ANC. Okay? So it depends how you respond. And there are different types of IVF. There are short protocol, there are intermediate protocol, and there are long protocol. Some women will not respond the right way, and we begin to stimulate, we begin to go further until we get what we want. We are not in a hurry. So some women can start early, go early. Some women can be delayed, but the end product is to make sure you have a positive pregnancy test. If you are planning for IVF, stop planning. Do it. Planning can kill your joy. Sometimes we overplan or we underplan. Just do it. Go and commit yourself to that partner, pay some money. Once you put something in your view, once you make something a priority, God is going to make a way for you. Because for every baby that God will give you, God has already made a way for that baby. Your babies will bring you good fortune. So some people have been planning for the past 10 years. They are stuck in planning phase. Don't be stuck in planning phase. Start execution. Start doing. So if you have been planning for IVF, the plan is over. Go and get it started today. If you need to register, my admin, my COO is in attendance. She will follow you up and she will send you the links and you will register. There are different packages. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. And if you are already pregnant, we have a provisions for you. Then we also have a group of women that are believing God to become mothers. You can go there and you can learn a lot. So everybody is provided for. But take your bold steps today. If you are in Facebook, we have our group, we have our page, we have our virtual group. So there are so many places you can catch me. You can catch me in our health club, SGHS Health Club. You can catch me in our page. You can catch me in my private timeline. Then of recent, we also have 2 different timelines. SGHS Virtual Admin and SGHS COO Virtual. You can catch us anywhere there. Now we are in YouTube, we are in Instagram, so there is absolutely no way you will lack knowledge. that will help you. We are everywhere. So make sure you follow us in all the social media handle. Okay? All right, guys, I will round up at 30 minutes. Thank you for coming. Please share this video with anybody you feel might have a need for it. Share it with your partner, especially your male partners. Some families are having problems today because the man actually is the problem. He's ignorant and he's standing in your way of doing the right things. Encourage your partners to attend the event with us. Okay? All right, guys. Thank you for coming. Enjoy the rest of your evening. The next clinic in YouTube will be on Saturday. But join me tomorrow for our community health open clinic. Don't miss that event. I'll see you guys tomorrow. Until I see you, God bless you and bye-bye for now. Okay, Joy, you've been planning since 2020. What are you still planning for? Look, let me tell you the truth. If you have to borrow money to start your family, borrow money. Your babies cannot be collateral. There is nobody that will take your babies away. But if you keep planning, if you start planning in 2022, by December 2022, you're still planning. Break that cycle of planning. Just start. Okay? All right. God bless you and bye-bye for now. And if in the past you did something and it didn't work, go on break. Come back and go again. You know yourself. You know who I'm talking to. Don't ever give up until you have your baby in your hands. It's not over. You're an overcomer. Keep on overcoming. Keep on believing. Go back to the drawing board. Do everything you have to do. Acquire all the knowledge you need. Then go again. Don't allow infertility steal your joy. Don't allow infertility bully you. Refuse. Go again. Take some time. Take some break. Then go again. Okay? All right. Okay. Okay, Joy, you've been following me since 2020. Okay, good. Yeah, hopefully I've been helping, give you the knowledge you need. But thank you for coming, guys. I have to go now, and I'll see you guys tomorrow. God bless you and bye-bye.